Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. Accidents happen, but when injuries occur, sometimes it makes sense to use insurance other than your medical coverage. Joining me today is Shawn Stack, a policy director at the Healthcare Financial Management Association. Shawn, you and I have talked about health insurance a number of times and how to navigate that process, but liability insurance is a whole different process. How does that work?
There's general liability insurance, for instance, insurance that covers falls or injuries that occur on someone else's property or business. This type of insurance typically covers immediate medical costs for injuries that occurred based on the location and the insurance policy covering where the incident occurred. And then, of course, many times automobile insurance is involved as the liability insurance. And in that case, the most common coverage is referred to as personal injury protection or MedPay auto policy. That insurance is intended to pay medical bills for you or your passengers regardless of fault. Auto medical coverage usually has caps like $5,000 or $10,000. So serious injuries often shift costs to health insurance, but that auto insurance is there. And fault does matter in auto insurance. So if another driver is at fault, their liability coverage may reimburse your medical expenses, but that process takes time and may require legal action.
So in the case of an injury at work, workers' compensation comes into play. Is that considered liability insurance? And if so, how does that process differ?
Make certain that you tell your doctor that this is a work-related complication. That gives a prompt to the provider that workers' compensation coverage may be involved and that they need to flag that visit or that service as workers' compensation.
Liability claims can take years to resolve, which could mean you're getting a bill from a provider that you're not actually responsible for. How do you handle that situation?
You want to be proactive and transparent. Let the provider or the hospital know your care is related to an accident and the liability claim is in progress. Give them your auto insurance or your health insurance information or your workers' comp information for your employer. Ask about billing practices. Clarify whether they bill your health insurance first or wait for that liability claim to be initiated.
That's it for us today. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.